Okay, I'll start now. Okay.
Yes.
Good morning, one and all. I'm Dr. Mansurali Kurgade. The topic for my oral presentation is serological evaluation of clinical suspected leptospirosis cases at a tertiary care center. Coming to introduction, leptospirosis is an acute bacterial septicemic febrile disease caused by pathogenic leptospira affecting humans and animals all over the world. The disease is presently endemic and deeply entrenched in Gujarat, Maharashtra, Karnataka, Kerala, Tamil Nadu, and Andaman and Nicobar Islands. High risk areas include Goa, Andhra Pradesh, Telangana, Orissa, and West Bengal. According to WHO case classification, suspected case is a case that is compatible with the clinical description and a presumptive laboratory diagnosis. Presumptive diagnosis, a positive result of a rapid screening test such as IgM ELISA, latex agglutination test, lateral flow, dipstick, etc. Aim and objectives to study clinical profile and prevalence of leptospirosis in clinically suspected cases admitted at Gandhi Hospital. Methodology, inclusion criteria, patients with suspicion of leptospirosis who are admitted at Gandhi Hospital. Exclusion criteria, acute febrile illnesses cases diagnosed as enteric fever, dengue, malaria, strep typhus. Sample size and duration of study, 164 cases were enrolled in the study in a duration of 1 year, that is from 1st August 2020 to 31st July 2021. Methodology, serum was collected and subjected to leptospira IgM ELISA as per manufacturers, that is TAN BioKit instruction protocol. This slide is showing the pictures taken while doing ELISA. Results, out of 164 enrolled patients, 87 were males and 77 were females. This is the pie diagram showing the same. This is the distribution of cases as per timeline. We can see the peak of cases during January, February. This is age and gender distribution of 164 cases. Maximum cases were seen in the age group of 21 to 30. There were 16 males and 31 females, making it to 47 cases. And least age group enrolled patients was belonging to 74 to 80 with one male. Positive cases, out of 164 cases, 32 cases, that is 19.51% were positive, 132, that is 80.48 cases were negative with IgM ELISA. Among 32 positive cases, 21 were male and 11 were female. The majority of positive patients belong to 31 to 50 years of age group, and least enrolled patients belong to 0 to 10 and 71 to 80 years of age, where no case were found. The youngest and oldest male positives were 25 and 68 years respectively, and the youngest and oldest female positives were 20 and 68 years respectively. This is the age and gender distribution of the 32 cases. As I already mentioned, 21 most of the cases belong to 21 to 40 years age group, and no cases were seen in 0 to 10 and 71 to 80 age group. Clinical profile of 164 cases, fever was seen in 68 males and 64 females, totaling to 132, and least common symptom was seen with dyspnea. 22 males were seen and 14 females were seen, totaling to 36. Clinical profile of 32 positive cases, fever was seen in 29 patients, jaundice was seen in 21 patients, and dyspnea was seen in 4 patients. Coming to discussion, comparative study based on male and female was taken from 4 studies, and it was found to be male predominance, matching with my present study. And this is comparative study based on clinical profile, and my study was matching with Agrawal et al. And others in most of the cases. In the present study, males were most commonly affected, which was in concordance with all other studies. Hence, adult male involvement seen in the present study reflects high risk of occupational exposure similar to other studies. The clinical profile of the present study was in concordance with Agrawal et al., with fever being most common symptom and dyspnea being least common symptom. Conclusion, only 32 cases, making it to 19.51% out of 164 cases with clinical suspicion of leptospirosis were diagnosed positive with leptospira IgM ELISA. Those cases tested negative by ELISA should not be overlooked and necessitate the need for higher molecular modalities. This study helps to estimate the burden in the community and to improve preventive measures and implementation of proper health education to control the disease burden and thereby decreasing mortality and morbidity. These are my references.